Okay, well, look, we'll kick things off, and I just want to welcome everyone who's joining us for this State of the Nations session from all across the United Kingdom to have that check-in really with what's going on in the different nation groups and just look at the different issues, because I think it's really useful for our members to have a sense of what else is happening. Sometimes there's a risk that we can be a bit siloed off and not really have a wider sense about what's happening. And I found that when we did this last time, what was really useful actually was finding out that despite the different models, despite potentially some of those variations and different challenges, actually so much was shared across the membership, which speaks to, I think, the national role that the council has to coordinate and work with everyone, but also where we can put our heads together to look at solutions and to look at what we might be able to learn from each other on this as well. So we've got a really great panel of people to address these challenges and opportunities. We very lucky to have Professor Jackie Kelly, who's the convener of the Council of Deans of Health England. Got Professor Kenda Crozier, who's the convener of the Council of Deans of Health Northern Ireland. We're very lucky as well to have Ewan Dowie as well, who's joining us from the Council of Deans of Health Wales to offer an update from the Welsh perspective. And a little bit later on, we'll have Professor Susan Dawkes, who's the convener for the Council of Deans of Health Scotland, who'll hopefully be joining us part of the way through, and she'll be able to offer her update as well. So just a reminder to everyone that you can put your questions in the box, and hopefully we'll be able to look at some of those points a bit later on. Again, very keen to hear your thoughts and pick up your experiences as we go as well. But what we're going to do is start off with Jackie first, then Kenda, and then Ewan for just a bit of an update about what's been happening, what's been on the agenda really over the last year, 2 years for the different nation groups. So over to you, Jackie.
Thank you, James. So small exam question. Huge thanks for the introduction, and delighted to be here just to have this conversation with colleagues. It was really great actually to see a number of colleagues at our recent Council of Deans of Health conference, those of us that were in Newcastle. So I'm really thrilled to be here representing COD England. And just to start with a huge thank you to all of the regional chairs, to Anne Kopopoulos, who is the deputy convener for the group, and also to Emma in particular, and the council team for all the support that they've offered Council of Deans of Health England group. We're probably the newer group, I think, of the 4 nations in terms of being configured over the past few years. But I think it's just really, for me, one of the key headlines for the work that we've been doing through COD is how we have actually come together as a group, trying to share that intelligence and learning from best practice across the regions, to set our agenda and, to ensure that the issues that we are bringing to the collective group are fed from those priorities from the regional groups. And I think that for me is critically the strength. Those of you that are not familiar with the work of COD England, so we meet sort of 3 or 4 times a year, usually online. We have one face-to-face meeting, but also sort of ad hoc engagement with us as a collective group throughout the year, where there are particular questions that are coming up from the English context. And I think what that cohesion and that collective voice has enabled us to do is to make sure that we are sort of reinforcing the value of our collective positioning. So each of the regions in England have very different issues at times. And I think if there's one reflection for me from the past year, I think we've seen perhaps less of the significance in terms of that difference, and more of those conversations coming from different HEIs in different regions, having more common agendas. And I think that is more about the landscape that we're in and the changes that we are seeing. So many of the regional updates that are reported into COD England have brought very similar issues. And I'm sure as we go on and talk, get updates across the 4 nations, there will be, and we were talking about that ourselves, there's a lot of commonality. I think for me, much like we talked about in the policy update for the COD national team itself, real political shifts, both with a big P and a small p, have been significant issues for us in COD England, both sort of national and local government changes. And the biggest headline for us at the moment, and we're in the midst of it now, is the changes that have been announced around NHS England in particular, moving into the Department for Health and Social Care in relation to that oversight and governance, and what that will mean And that sort of led to a lot of uncertainty, I think a lot of increased turmoil, because we're currently navigating that interim space between the what has been and what will be, meanwhile trying to keep business as usual underway. And I think in many of our conversations in recent weeks and months, that has been a real big challenge. On top of that, the reforms for NHS England, of course, mean reforms for us in the England context around the integrated care systems and integrated care boards. And again, that has been a real issue and a real challenge. And I think one of the things that we've seen as a great success for in England from each of the regions actually is how, as regional groups, we have reached out and individual universities have reached out to build those relationships with their integrated care systems and to build those relationships with the boards and board members and to have, as if you like, a space at the table. And I think where we are at the moment, the structures, those people connections and those really important relationships that we've worked really hard to establish, the conversations at our COD England meetings are about the risks around that, losing that sort of important local context, and with the changes that might mean in personnel in some of those roles, with those representatives that we engage with, and that shared understanding may change or we may lose some of that. And I think that remains a constant agenda that we are discussing on a regular basis. So I think it is the ever-present constant of change is the thing that has been driving a lot of our conversations. And again, there's a Four Nations context for that, but also very much an England structural context for that. And as I said earlier, we often see differences in regions. So if I reflect on last year, where we were talking about a different picture across England around student graduate employability, we were seeing different hot and cold spots in different regions for different professions. For me, that's one area that I think we've now coalesced around. Everybody is seeing a very similar picture, that there are real challenges in different geographies around different professions, but consistently the message really that, for our contribution to our B3 metrics, our TEF contribution around employability, that was almost a given that we could advocate within our universities and within our regions as a positive contribution from universities, is something that's now more challenged, because that employability picture is looking more challenging and more fragmented. So I think those are some of the things that we have been discussing. Again, for us, the changes in the degree apprenticeship funding priorities, that's again been an area of focus for us, and particularly in recent months around the use of levy for the real risk that's presented to our level 7, the postgraduate, post-qualifying provision, particularly for many of our universities who support advanced clinical practice, for example, which has been very much part of the multi-professional workforce skill development with our system partners. And we really are, as a nation group, drawing on our regional knowledge and intelligence to remain engaged, to ensure that we can advocate for this to be revisited, or indeed alternative opportunities explored, in terms of how we can not only support and sustain the workforce and innovations that the government pillars suggest they might need, for example, around advanced practice and community, but also how we can make sure that the investments and in staff and infrastructure that we have developed in our universities doesn't go to waste, and we have the opportunity to continue to deliver in that very sort of specialist and innovative and creative space. So I think that's, again, something that we've talked about. I just alluded to the fact that we're in this period of change. So we await imminently, don't we, all of us, in the coming week or so, the 10-year healthcare plan. And latterly, we will then see revisited the 10-year long-term workforce plan. I think the term that, James, you've been using or others have been using is a refreshed long-term workforce plan. I'm not sure whether how refreshed our members at COD England are discussing that. I'm not sure refreshed will be quite the description. It might well be very fundamentally different. And again, those are things that are we have been talking about that I think will set the landscape for our engagement in the coming weeks and months. And it's been something we literally just met at our face-to-face meeting last week. And we talked a lot about that. So in many respects, the work that we've done this year is to come together as a collective voice, to be able to be very sort of responsive as a COD England group, to be a group that brings the knowledge and intelligence from across the regions very quickly if we need to make a very rapid response to a Council of Deans inquiry that we've had, perhaps from legislators or from others. And I think for me, that's been both the privilege and a challenge and a demand, But the really good thing about having a COD England group, and I've certainly really valued that both in my role as PVC Dean at Anglia Ruskin University, drawing into that resource, but also being part of those conversations in our region in the east of England and feeding into that. A couple of other areas that of highlight, and my apologies to colleagues from COD England if you don't feel I'm picking out the appropriate headlines, but there'll be opportunities to perhaps add that into our later discussions. The social realities that I think we've all talked about in our UK group around some of the challenges for our students. So I've talked sort of about that political landscape for us with a big and a small p. For me, I think the most important conversations that we're having is about the realities of our students' experience. And that is around the cost of living pressures that our students have, perhaps some of the mental health issues that we're experiencing, and some of the shifts and changes of their expectations, and how we meet and address that as a collective. And again, I think that's where there's been a real value in coming together to learn from others. There's been some really creative and innovative approaches to working in partnership with our students and learners in that space. And what I think is the value of coming together as a COD England group is we've been able to very quickly share that learning and not reinvent the wheel. So I think that's the other area that we've spoken about. I wouldn't I'd be failing my colleagues if I don't mention recruitment. So whilst we have had the opportunity to share great innovations, really good practice, etc., some of the real challenges is the growing demand for sustainability of our own operations being very connected to some of the real challenges that we're seeing around the challenge for recruiting to particular disciplines. And again, similar to perhaps some of the employability conversations that we've been having in recent years, I think for me, the stark contrast to that this past year has been that we're really talking about some challenges in all of those professions. We've not just focused around small and vulnerable professions. We're seeing also professions where we're looking for high numbers, for example, adult nursing. Everybody's reporting a very changed picture. And I think some of that is about, some of I talked about degree apprenticeships, the different pathways. So some of the areas that we've discussed with colleagues that we've invited in, we've been trying very much as a COD England group to invite in key colleagues to have those discussions and engage those discussions with us. So we had Duncan Barton, for example, as a newly appointed Chief Nursing Officer for England, come to our autumn meeting. We tried to engage him with Duncan very early in his tenure to try to sort of advocate in relation to the nursing and midwifery picture in particular. Liz Fenton has recently joined us also for our in-person meeting last week. Whilst we talked a lot about employability concerns, we also talked about the recruitment issues, the sort of lack of visibility and positive narratives around the healthcare workforce, and some of the issues around how we as anchor institutions actually want to be part of the solution. And again, we were able to bring to some of those key stakeholders an opportunity to hear from us firsthand about the ways that we as universities want to work across the systems to ensure that we can support solutions and deliver sort of innovations. And again, as I said, there's been lots of nice examples that we've been able to talk about how we've diversified our pathways, how we have invested in our own simulation infrastructure, how we've supported placement innovation, where that's sort of challenging for students to get to placements or to deliver particular competencies. But back to that sustainability for higher education, I think that's been really stark. We're in a real state of change and a state of uncertainty. We, as all universities, again, our discussions last week were about all of us facing very different, restructures or reorganisations within our own organisations, and the impact that is having on our ability to plan ahead. And some of the emphasis that we've been bringing to those stakeholders that we're inviting into our meetings has really been trying to emphasise that opportunity to work with us, but to support us around sustainability and to make sure that the higher education context is part of their conversations. So I think my summary would be, we really have had a real opportunity as COD England to draw from each other's innovations. We've advocated very strongly collectively, particularly with regulators. Need I mention Ofsted and NMC? That's focused our mind this year, but we've also been able to share some really good practice and to push back at some of those organisations to understand our context. And I think with some success in the past year, particularly I think with Ofsted and NMC, HCPC perhaps being a different kind of engagement, and often more positively a listening ear. But for me, we are the better together, and that's been the strength of COD England. And it's a real privilege to be here as the convener to just share a few of our headlines. I hope I haven't done colleagues a disservice and I've captured a few highlights of our year. But I'll hand over to you, James, and hopefully we can pick up the rest in some questions. Thank you.
Thanks, Jackie, and not a disservice at all. It's always really difficult to summarise the full extent of everything that's gone on. And I know just the privilege I have in my role is being able to dip into each of the nation groups. And I know how much work goes on publicly, but also so much work behind the scenes. And just a huge thanks to everyone who's involved in the nation groups, because they work so hard on behalf of their members, but also the council in general. So we really are so much stronger, I think, because of that collective work. And that collective voice. Thank you, Susan. It's great for you to be able to join us now. You dipped in earlier than I thought you were going to, but also just so telling already. I could see you nodding away to lots of what Jackie was saying, because I think already you can start to see where some of those similarities are. But speaking of similarities, we have someone who's really well placed, probably uniquely, to think about the differences, but the similarities between the different nations. And that's Kenda, who was previously on COD England and based at an English university, and is now back in Northern Ireland and has taken up the convener role there. So it'd be really interesting, Kenda, to have your reflections on the work. I know it's a bit harsh because I know that you're newer to the role in Northern Ireland, so that there'll be lots that's been passed on to you, but also if there are any reflections to build in on where those differences are that you've picked up. I think you've got really interesting insight. So over to you, Kenda.
Thanks very much, James, and thanks, Jackie. Yeah, it was really interesting listening to that. And just reflecting on the size and scale, I guess, of COD NI. Really, having been the chair of the kind of East of England group before I left, which had 5-6 universities. I've come to Northern Ireland, and we're small and perfectly formed. 3 AEIs in the north. That being Open University, Queen's University Belfast, where I'm head of the School of Nursing and Midwifery, and Ulster University. And we're quite uniquely placed in that we have kind of got direct access to Department of Health in a much kind of slicker way. The Chief Nurse and Midwifery Advisory Committee is a group that meets regularly every 2 months, I think, in Northern Ireland. And that comprises all the executive directors of nursing from the 5 trusts in Northern Ireland, and the heads of school are also invited to that meeting. So we've got direct access to that group. And so that's really, really useful, actually. It's a great way of kind of keeping our finger on the pulse of everything that's going on in workforce and in the clinical big picture things. And also another example of kind of good practice here in Northern Ireland is the Northern Ireland Placement Learning Collaborative, which brings all 3 AEIs and practice partners together. And this is a critical formal partnership endorsed by the Chief Nursing Officer to bring issues of mutual interest and concern to the table around placements. So challenges that there might be, bottlenecks, areas that we might want to develop for placements, and kind of thinking about regional planning then. And also things like simulated learning and our electronic practice assessment document get brought to the table there. So that's a very useful collaborative that we have that's well established here. And to some of the issues that we're facing here in the north of Ireland, the students, healthcare students in Northern Ireland are they have their fees paid by Northern Ireland government, and programme places are commissioned. So that's across nursing, midwifery and allied health programmes. Now, the commissioning cycle for the undergraduate student cohorts on health programs is a tricky thing. Last year, the commissioning letter came in to the universities literally a few days before the rejection by decline UCAS deadline, which makes it very, very tight for universities because they've got to make their decisions about offers. Really almost in the dark. And this year, the letter came in a week before. So we've been lobbying Department of Health really through regular meetings with the civil servants there around having a 3-year planning cycle aligned to workforce planning. I think the 10-year workforce plan in England, when that is refreshed and relaunched, I think that's a great opportunity because in England you're able to look at what's needed by across the country and by region, and that helps with the planning of programs in universities as well as workforce. And that's something I'd love to see us being able to have closer alignment with here. Of course, one of the other issues that I think is common across all the nations is student finance. And as I've said, students here are very lucky in that their fees are paid for, but they receive a bursary. Their bursary is a very generous £430 to £480 a month. And that is all the finance they're entitled to. It's not generous at all. They're not able to access student loans or maintenance loans or anything like that. It's only the bursary that they can they receive. Although they can claim back their placement travel time or travel costs. Sorry. And the fees that the university receives from government, of course, are not the same as the fees that the other UK universities would be charging. And I'll make it clear that they are less. The unit price for AHP programs has not changed since 2009, not even an inflationary increase, nothing. So that gives you an example. So we're, in times of university financial constraints, we're running programs here that are, exactly the same requirements as in the rest of the UK, but on a reduced fee per head. And we have raised the issue around student finance with the Minister for Health. And I think it's something that our vice chancellors are also lobbying when they have meetings directly with the Department for the Economy around the university financial settlements for the years. So that's an important area that we're looking at. So far, with limited success, but we continue to kind of push on with that. One of the other areas of concern that we're facing is concern about corridor care and the fact that is being almost normalized in our hospitals here, and having seen earlier this year an advert for a corridor care coordinator, that's kind of quite alarming. So the council, the COD NI have written to the chief nursing officer to express concern about that, and she's going to be meeting with us in July to kind of talk about potential solutions around that. Concern really there is that students are seeing that as a normal part of care, and then how are we, how are we addressing that in terms of their learning of what's normal? Yes, and one or two small areas. Ulster and Queen's are collaborating in delivering the Master's Advanced Practice Nursing programme across the two universities. We've come together and worked with the Chief Nursing Officer and her teams around what's required for Northern Ireland. And we've developed our programmes collaboratively. And then we will be obviously those programs are also commissioned, so we're able to kind of divide those up between the two universities according to our areas of expertise. So that's another quite a nice example of collaboration. We're also seeing, one final point, places on the nursing courses here being commissioned by the Irish government as well, in addition to the NI government, and that's in recognition really of their workforce shortages in the Republic. So that's an interesting, but the Irish government's financial cycle is different to the Northern Ireland government's financial cycle. So the calls around that come in at different times, which doesn't necessarily take account of university financials and recruitment cycles. So while that is useful for us, it also provides a little challenge. So that's all from Northern Ireland.
Thanks, Kenda. And again, I hope that lots of attendees who are listening, given the size of Northern Ireland as well, obviously overwhelmingly have members from outside, but there is a lot going on, and I'm always so conscious that along with, as I've said, individual challenges, but shared challenges, there are interesting lessons that each of the nations can maybe pick up from each other, whether it's in how members are responding or in things that governments are maybe doing that we could try and influence other governments across the UK to look at where we think there are good lessons to learn as well. So over to Wales and Ewan, and it'd be interesting just to hear your thoughts from a Cod Wales perspective and what's happening there in Conscious. I know we're thinking about kind of what's happened over the last kind of year or so, but I know maybe perhaps a bit later on we'll also be thinking a bit about kind of what's coming up as well. So over to you, Ewan.
Lovely. Thanks, James. And I do apologise because my internet dropped out just at the end of Kenda's talk there. But many of the issues that Kenda was talking about is very similar to Wales. We're a small nation, so one of the successes we have as part of being a small nation is that we're able to work very closely with Welsh Government, able to work very closely with our commissioners, because we're commissioned as well with HCIW, and we have very good relationships with both of those organisations, which is absolutely instrumental when we want to obviously raise some challenges and some of the concerns that we have as a group. So we usually have a minister that's online that normally can come in and talk about those things. So one of the successes we've had this year actually is that we've had a high-level meeting with the Cabinet Secretary for Health and Social Care in Wales, which is Jeremy Miles. That was in January, and then addressed some of the key issues that we've had recently, which includes student recruitment, retention, bursary reform, and regulatory quality assurance challenges. So one of the things that we've had, and I think everybody has it across the whole of the UK, is some of that student recruitment challenges. In Wales, it's particularly acute because obviously we're in the west of the UK as well, and it does mean that sometimes we're not quite as attractive as the larger metropolitan cities, and sometimes we do struggle in having recruitment to some of our institutions. So we have institutions as far north as Bangor, but we also have it, we have institutions in Aberystwyth, so they tend to be more smaller, sort of community focused areas, and sometimes that can cause its own student recruitment challenges. Similar to Kenda, we have an issue with bursaries. Our bursary provision at the moment is relatively small. Most of the students only receive £1,000 for the year. They do have some access to the maintenance loan system, but obviously that's variable, and there's quite a bit of means testing if you want to have a top up to the bursary. So that has been a real challenge for us. And of course, most of our students do tend to come from a more mature background. They've already had often, children, and they've often got caring responsibilities as well, so that money doesn't go very far. So that's a challenge for us in Wales. Tuition fees are paid, and we are having indications from HIW that they will match the tuition fees level for other courses as well. So that's welcome news. So again, having that close connection with HIW has allowed us to have those conversations and for them to understand the real financial pressures that our students are currently suffering with at the moment, and they are real financial pressures, and obviously inflation hasn't helped either. We have regular engagement with the Chief Nursing Officer, the Chief Midwifery Officer, and also the Chief Allied Health Professional Officer as well within Wales. They come regularly to our Council of Deans Wales meetings, and again, we update them with any issues we may have, but they also give us the latest news in regards to some of the political issues that will be coming ahead, and some of the other aspects that we need to be aware of as a nation. Couple of things that we've been doing recently. The RCN have come up with a report on corridor care. So one of the issues that we faced in Wales was patients being looked after in corridors, which is an acute problem, I think, across the whole of the UK as well, not just Wales. So the RCN have highlighted that as an issue. We've been obviously advocating as a council in helping the RCN in pursue that agenda, and obviously Welsh Government are listening to that as well and are trying to put steps in to mitigate corridor care in Wales. So it shows the impact that we have and the influence we have as a council in helping to formulate that policy. So that's been really welcomed. The other thing that we're hoping to have very shortly is a research strategy input. So Nation Group members currently do development of a national research action plan for Wales. One of the things we're looking for is more nurse academics accessing things like PhD, professional doctorates and so forth to ensure that they're sort of becoming more familiar with the research side, and also to develop that research side in Wales. So research in Wales is still relatively in its infancy, especially within the nursing profession. Obviously it's building up some steam now, but obviously we need to progress that further. So what we're finding at the moment is that a lot of nurse academics are finding it difficult to access PhD schemes and professional doctorate schemes, often due to expense and various other issues as well, and time. So it's making sure that we can set aside some time and also some of that financial support to allow nursing academics to enter into that space. But also non-nurse academics, we have clinicians out there as well that want to access PhDs and higher doctorates and masters and so forth. So that's an area that we're looking to develop as well to ensure that we are upskilling the workforce as well. As I said, some of our highlights is collaboration with HIW and our engagement with Welsh Government, but some of our biggest challenges at the moment are financial pressures. I've already alluded to that. So we've got ongoing financial constraints affecting programme sustainability. You might have heard in the news about the issue in Cardiff University. So Cardiff University, we're looking to close nursing. The good news is Cardiff has, they've gone back on that and they've decided to keep nursing, but it's in a very much smaller provision. So that has an impact across all the HEIs then in Wales, because obviously somebody else has to take those extra students because of commission courses. So again, that adds to some of the financial pressures that we have, and also the real problems of trying to fit extra students into a very smaller real estate as well that we've got to think about too. So whilst we welcome the news that Cardiff has decided to reverse its decision, it does still have an impact across nursing across Wales. The one thing that we were concerned about is that obviously when one university says that they're going to step out of nursing, we were worried that could cause a sort of precedent, and then that would mean other universities might follow on from Cardiff's lead, but thankfully that hasn't happened. But it just shows how nursing is vulnerable, I think, amongst universities in the UK. And at a time when universities are facing real financial pressures, it's something that we just got to be very mindful of. And we're just very much acute to that at this moment in time. I've already mentioned about the student funding. HIW reporting, navigating complex and evolving reporting requirements. So HIW are our commissioner, but quite often there's that regulatory role that they sort of also perform as well, which means that we have to often produce some very complex reports and provide lots of data and so forth to HIW, as well as meeting NMC requirements and regulatory requirements, as well as meeting university requirements. So there's a lot of things that we have to produce in Wales, which sometimes can seem overburdensome. I'm sure there's a real reason for it, but sometimes we would like to know where that data is going to. So sometimes we're having conversations with HIW to ensure that we're not over-reporting, and can we streamline some of these processes as well. Recruitment and retention, I've already mentioned the ongoing challenge in attracting and retaining students. Retention is still an issue for us as well. So students are finding it, because of financial pressures, more difficult to stay on a 3-year long programme. So one of the things that some universities are looking at the moment is part-time provision, and a way that we can build the nursing course in a way that's more work balance friendly, so they're able to still meet those caring responsibilities, meet that work-life balance, whilst also undergoing a nursing degree as well. So we're looking at different options where some of the universities are within Wales to obviously address that issue. There are investment disparities, noticeable differences in funding for simulated practice learning compared to England. So at the moment we find that we have less. So that's something else that we're having conversations with our government with. and again, research funding, limited ring-fenced funding opportunities for healthcare professionals in Wales. So again, that's something else that we need to, pursue and obviously influence too. Looking ahead, well, Wales is going to have an election at some point next year. I think it's due March, April time. One of the biggest challenges for us is that at the moment we've had a Labour administration for the last 30 odd years since the Welsh government has been, since the Senedd has been established. We're looking at two parties in particular that seem to be neck and neck. We've got Reform that has suddenly gone up in the polls, but we've also got Plaid Cymru. At the moment, they're sort of neck and neck in the polls. What that means for us in Wales is that there will probably be a change in the administration. Now, admittedly, a year's a long time in politics, things can change, but it does mean that we would have a different administration potentially in power. So obviously that will have an impact upon health policy and influence how health is seen, not only by politicians, but also by the general public. So we're just mindful of the fact that we're going to have a massive change probably next year, and it'll be interesting to see what the policies are of those different respective parties. One of the things that we do in Council of Dean for Wales is obviously look at the manifestos, try to influence those manifestos as best as we can, make sure that nursing is at the top of the agenda, and midwifery and allied health as well, make sure that they're at the top of the agenda, making sure that health is something that is talked about by those parties. At the moment, we tend to know that one of the top priorities that they seem to talk about at the moment is immigration. But obviously, one of the biggest issues in Wales is actually health and the health service. It's in the top, it's one of the top 3 issues that face the people of Wales. So it's something that we have to address as well. So we have to make sure that the political parties are aware of the importance of health and how we can fund health going forward. Other things that are coming up, community focus, embracing the transition towards community-focused care models to better meet evolving healthcare needs. This approach is reinforced by Allied Health Professionals' AHP Framework for Wales, which embeds community care as a core principle. But I think community care is something that we've been talking about for the last 50-odd years, certainly since I've started, and sometimes we don't seem to make much progress with it. So we talk a lot about community care, but we still sort of focus mainly on the hospital-based care rather than those things that really make a matter to people's lives. So community care is something that's very much a priority for Council of Deans and also for NHS Wales at this moment in time. The other thing that we're just mindful of is the introduction of artificial intelligence, the introduction of ChatGPT, all those sort of things that are happening at the moment. That has an impact upon nurse education, so one of the things that we're looking at as universities is how we can change our assessments and so forth to adapt to the ever-changing, society that we now live in. So people are going to ChatGPT to write their essays for them. And we're sort of a little bit naive if we don't think that's happening. So we've got to address that. We've got to make sure that the students that are leaving our universities are actually, able to do what they're supposed to do. So I think that's really important. But also, AI has its benefits, and we'll probably see a lot more AI involved in care. We may one day have robots doing some of that care. I know we've got some pilots in certain areas, but that's certainly going to become something more of the mainstream in the next 10 to 15 years. So again, we have to adapt to make sure we can meet those new technological changes as well. The other big thing that's happening is the introduction of the registered nursing associate role in Wales. So we haven't got it at the moment. I think it's an England only role. So Wales is looking to introduce that in the next year or so. We're just waiting for legislative permission from the Westminster government. So Westminster has to change its statutes to allow Wales to be added onto the statute, and then we can go ahead and introduce that role. So there's already planning going on in the background. Council of Deans has been very heavily involved with that as well. So hopefully we'll see that role coming up very shortly. And my last final point, which is just another challenge to end with, whilst it's all very welcome, we're seeing the NHS obviously increase its pay across the board for clinical staff. There's a challenge for us in Wales, especially in universities, where we're trying to attract nurse academics into the universities, but our pay awards are often a lot less than the NHS pay awards, and at some point they're going to be matching, and in some cases they could be surpassing nurse academic salaries. So it's a challenge for us in Wales because we're quite a small nation, so we can't afford to lose too many nurse academics, because that would have a big impact for us when it comes to teaching our students. So we're just mindful of that, and we're making sure we're lobbying the appropriate people to sort of remember that nurse academics have a big part to play in obviously the future of nurse education, and allied health colleagues as well. So that's it for me for Wales. So thank you, James. Handing back over to you.
Thanks so much, Ewan. And again, I mean, seeing people nodding away because, again, so many of these kind of commonalities that are in place. Really conscious, obviously, with elections coming up, there's the role of the council to support Wales and Scotland in terms of any documentation that you might want to put together. So conscious that we had the manifesto that was put together for the Westminster election. And of course, we didn't prioritise the bullet points, but the first one that we did have was about the sustainability of the education and research workforce, not because we don't worry about the other priorities, which were about student recruitment and retention, regulatory reform and placements. All of these are equally important. But I think the council just found that if we weren't talking about that, no one else was really saying it back to us. So that's why we put it in that position, really, just because it felt like unfortunately, quite a unique thing that we were raising. And I think we've got to the point where we're starting to finally hear it back, but now it's the action that we need. And perhaps the theme across all of the nations is that desire to have better join up between education and health when it comes to the sectors, but also departments and government as well. But again, conscious we've got some interesting examples coming up from Scotland and you, Susan, and of course an election year next year for Scotland as well. And again, we've had so much going on politically and polls all over the place. Scotland feels like it's maybe stabilised in terms of what we have a sense of what the outcome's like. But I think Ewan's completely right. We live in turbulent times, and what the polls are now don't necessarily reflect where we end up next year. But I know that there's a lot more than just looking ahead to the election. So Susan, I'll hand over to you.
Thanks, James. Can you hear me okay? My computer's been a bit weird today, so I'll just check that out to begin with. Hi, everyone. Really nice to be here this afternoon. Thanks for allowing me to give a quick update from Scotland. Oh my goodness, there's so many similarities across all four nations for sure. So I won't linger on some of the points because I think they've already been said. But if I give you a sense of where we are in Scotland, it might just kind of help to share what we're doing and maybe some of the challenges that we face that may be unique to us. So we are small. We're not maybe quite as small as Northern Ireland and Wales, but we have 11 Council of Deans members across the country, spread out geographically, from where we are in the south of the country up to Inverness and Aberdeen in the north of the country. So there's quite a geographical spread, but we cover the whole of Scotland. So if you look at Shetland, it's closer to Norway than it is to the mainland of Scotland. So there are massive remote and rural areas across our country, and as well as some more urban areas. So we are geographically big in terms of there's probably pockets of condensed urban populations, but actually there's a massive spread which brings huge population challenges, and certainly access to health and social care is really problematic in some of the areas. The workforce challenges that we have are unique to the different areas. So here in the south in Edinburgh and Glasgow, just the scale of the number of people that we need is massively challenging for us. If you go up to the north of the country, there's not that many people, to be really honest, want to work in Shetland, because it's so far away and it's incredibly remote and rural. So there's definite regional variations, I think, in terms of what our workforce looks like. Our funding model sounds quite similar to Northern Ireland, Candice. So we're commissioned by Scottish Government for our places for controlled subjects. So controlled subjects are medicine, dentistry, nursing, midwifery, and one of the allied health professions. But that brings opportunity as well as challenge to us. Very similar in terms of the fees for us have not changed in many, many years. So they're worth a lot less now than they were when these were first established. That brings massive challenge. Now, I'll come back to that because it's one of the biggest things. But to give you a sense of the scale of the recruitment issues that we faced. So in 24-25, the recruitment cycle just gone, we were commissioned across the whole country to take in 4,500 student nurses. All of the 11 universities were able to recruit 3,000 nurses. So we were 1,500 short, a third down. The year before that, we were 1,000 short. The year before that, we were 500 short. We're going in the completely wrong direction from where is actually helpful. We have one of the highlights probably of the last couple of years is there was a ministerial task force set up for nursing midwifery. Specifically, that task force is now at a point where 2 years down the line, we have come up with recommendations, of which there are 44. They span, some of it is incredibly basic. And when people look at this, they think, wow, how basic does it have to be? But from an NHS perspective, for instance, really basic things around health and well-being of colleagues. So do they have access to hydration while they're on shift? You kind of think on, you know, Maslow's hierarchy of needs, that's right at the very bottom. But if that's not being met, then we're in trouble with what goes beyond it. So there is that. I chaired the education and development subgroup, which I think is a real positive that council deans were involved at that level. For us, the real steer was around, you know, the universities have to think of different pathways for people to come into nursing midwifery specifically for this task force, and then think about different ways to actually educate them. So that's great. You know, there's a definite willingness across the country for innovation, for thinking about the different ways of how we go forward, as you said, Ewan, around, you know, AI, you know, AR, VR, whatever it may be. We have to embrace the technologies to do things differently. So that's been a real positive. Alongside that, there's now an implementation group being set up. Again, I'm involved at a steering group level, which is still ministerial led. There is challenges there. We're on our third Cabinet Secretary for Health and Social Care since this started. So different, you know, we don't really anticipate that the administration in Scotland will change even with elections next year, but you never know. We'll hold our breath on that one. But certainly from my perspective, I would say that progress is really slow in terms of actually coming up with how these actions now actually being put into place. It's not a lack of willingness, and actually the Scottish Nurse Executive Director Group, of which there's 14 territorial health boards across Scotland, it's quite small. It means we can get together in the one room. We're not challenged in that sense, but real sense to work together, and that really goes across all of the different, you know, agencies. So NHS Education for Scotland, the funding councils, our college sector, University of Scotland, everyone is really keen to come together to really figure out how we do this together. So that's great, and we do, I suppose, from time to time lobby the minister that I see very frequently. I meet with the Chief Nursing Officer every month, so there's a real regular dialogue between us. Doesn't necessarily mean that things are getting done. It just means that that dialogue is open and you know, available. But for us, very similar to what I've heard my colleagues say already. So financially, it's a really difficult landscape right now. Our government is absolutely committed to Scottish domiciled students not paying fees, which I support, you know, in terms of levelling up. But that brings challenge for sure with it. The changes to the visa requirements and the Westminster policies around immigration is really having an impact on us. So up to now, we have really relied on some degree of international recruitment of students to actually then essentially, you know, offset the kind of diminishing in real terms fees that we get for our Scottish students. So that is problematic. I'm worried about an academic workforce, as we all are, I think, and it's good to see that, you know, at the very top of the manifesto, James, for us. But you know, for the first year ever in memory, and I've been in education for a long time, we were subject to clawback from government. So we have a very tight margin to meet our targets because of that kind of geopolitical landscape. Really difficult to recruit students, as you know, and we were subject. Each university was subject to financial clawback. For me at Napier, it was £1.5 million, so it's not an insignificant amount of money. But that then brings challenge around sustainability of programmes, of which we are absolutely committed, but you know, we do have to control costs for sure. From a student financial perspective, that's also quite challenging. So we are, I think, the outliers. So our students get a £10,000 bursary each year. They have travel expenses paid after a kind of adjusted slightly, but they have travel expenses paid for their placements, which is great. They have their fees paid, but even although all of that is in place, we still can't recruit to the numbers that we need. So there's a financial review being done at the moment for students. So I think that's something they have to take on board as a government around, actually, we are paying out all this, but we're still not getting the return. So what is it that we do differently? The innovation, so we've had the task force for nursing, we've also had an AHP workforce plan, which again was really helpful, but the finances there are tricky. So for instance, physiotherapy students may be given a bursary. It's quite small. I think it's about £4,000 per year. None of the other HP students are afforded the same luxury. So really challenging. I think that there's not even equity across all of our professions, which is really concerning. But Certainly the infrastructure in place then to support students, I think, needs to be there. For us, we can innovate. We're really keen to do it. NMC are supportive of us coming up with different models of delivery. But at the minute, through things that are out with the HEI's control, it's very difficult to actually make that happen. So for instance, just in the last couple of weeks, I was told that if we did part-time programmes, of which I think will be great appeal for students who want to work alongside this, they were very fixed in that the Scottish Funding Council and the Student Awards Agency of Scotland stipulated that the programmes could only be 6 years in length for an ordinary degree and 8 years in length for an honours degree. There'd be no bursary and there'd be no travel expenses. So you give with one hand and you take away with another one. So we're still in that debate right now. Job availability is problematic as well. Our employability rates are still good, but there's certain areas of the country where jobs are not as plentiful as they may have been before. So I think if you looked at Scotland as a whole, there's probably is enough jobs for everyone. But if you train down in Edinburgh, the job may be available up in the north of the country, which is not necessarily something that might suit your family needs and indeed your own needs. So I think that is really, really problematic for us. We too have issues around, we don't have any funding for simulation, the availability that we have for financial support for people at early career, or even earlier than that, career opportunities for research is non-existent. I was involved in a study recently where Scotland fares worse than every other part of the United Kingdom. So that is massively problematic for us, that we really have to try and push forward. But I think going forward, the steer from the government is around preventive measures, stop people falling in the river instead of pulling them out at the other end once they become sick. I'm really supportive of that. How that will mean that we have to then change and adapt our programmes, I think, is still up for debate. But for me, I suppose the real positive is that we have a seat at the table now. There are times I have to say I work for government, or it feels that way. But it feels much more like we're not just an afterthought when we go, okay, it's already done, and actually then we're going to go and tell Council of Deans. We're much more involved in early conversations. So that to me is a real positive. But like everybody else, the HEIs can't do this on their own, but the collaboration is going to be absolutely important for us to do this. So huge challenge here, but I think there's a real willingness for innovation and coming together to meet our challenges. Thanks, James. I'll stop there.
Fantastic. Thank you, Susan. There's been so much that's packed into all of this. And I know that there's also a kind of a general instruction about kind of let's look at the specifics as opposed to the overlap, but I don't think any of us can help really that there are these overlaps despite really different models, obviously different regional variations, everything that might come within that. It's really quite telling that there are some underlying factors that are just common to all of our members. So sorry to lose Kenda at the moment, and conscious that we don't have loads of time left. I know we kind of said that there was space for questions, but actually I think everything's been so comprehensive that I know that last time round what people really took from this was almost just sitting there listening, taking in those differences, but also, like I said, probably nodding their heads as everyone else has been doing to those similarities. The upsides of it, I think, are that there is that scope for us to work closely together across the nations. But I suppose, unfortunately, the slightly negative slant on this is there isn't something that can easily be copy and pasted from one model to another and that's going to solve everything. And I know that before we started this, sometimes it felt a bit like a view that, well, if we just do what's happening in this part of the UK, maybe it can work here. And actually, I think what's been really useful for these sessions, and why I think it's such an important annual check-in, is that it just lets our members have a much wider view of what's going on and allows them to be realistic in terms of their hopes and their aspirations for change. Conscious we don't have too much time left, but we did have a few points I thought might be good just to close on, and then we'll draw it to a close. And really, if I can ask everyone to be very succinct. Now, we've touched on this a little bit. We've looked at largely at the past year and a little bit about what's coming up. But it'd be very interesting and perhaps a minute each, if I can ask you to keep it to that, just to look ahead to the next year and think about maybe the big opportunity for your nation. what's going on there and what we're hoping for from that. And it just means that next time we check in, we can look back at that and see, was that an opportunity? Did we embrace it? Where can we build from there? And sometimes, obviously, there'll be things that come around the corner we can't plan for. But Jackie, it'd be good just to hear your thoughts very quickly on that big opportunity.
Yeah, and I think the big opportunity is what we've all reflected, James, and Susan's just said that, in that coming together, we are better together, as I mentioned earlier, and I think that for me is almost the headline. I mean, for COD England, again, our discussion in our meetings last week, it's making sure that we use that time effectively. As I mentioned in my update, because we have got such diversity across all the regions in England, the regions do a lot of that work as well. So a lot of what we're talking about in some of the other nations is happening at regional level in England. And I think that's a really important differentiating factor. So it's also how, as a COD England group, we support the regional groups in terms of their function, and making sure that as a COD England group, we embrace that the sort of knowledge exchange that comes from the diversity of those groups, so that we can advocate strongly and come together to reaffirm those shared priorities and those key headlines. And, Ewan's mentioned academic workforce. We've all mentioned sustainability, which I think is critical. The sustainability of the courses, i.e. the professions, therefore the positive patient care. For me, the sustainability of the universities, our academic workforce and our infrastructure and capabilities are critical areas that we need to come around. And it's advocating with our legislators, with those people of influence that we can engage with. And certainly for England, and again, I've talked with some of the nation leads, the other nation leads, about this when we come together. It is sometimes, it's challenging in different ways, because we have a lot of stakeholders to engage with to try to get round different tables and have those conversations. But I think, so just because it is England, it doesn't necessarily mean that it's in any way, because we're nearer to Westminster, for example, then it makes that any easier. In fact, I'd say it makes it more complex. So part of our key work going forward is making sure that we do use those opportunities. We had a key strategy this year to invite people to our meetings, to demonstrate the effectiveness of coming to engage with us as a collective group, and that we can represent those regional voices. And as I said, that's where those regional groups are so critical to the work that we do as COD England. I think the main thing that we have been headlining is the higher education, and I think all the updates that we've had from the nations have recognised as a critical anchor institution within the system to be able to support. So as the 10-year plan comes out, as we have the refreshed workforce plan, we're not here just to support future workforce. I think if I say one of the biggest risks that I think that we talk about is that the energies in the room around perhaps the education and workforce piece is more dominant at the moment, I would say, than research and innovation. That's both for research intensive universities and for research active universities. And if I were to look at some of the risks and some of the areas that we need to coalesce around, it's making sure that we don't lose the research and innovation capabilities within universities. It links with Ewan's discussion around developing the academic workforce, because that's where we can, as anchor institutions, inform, develop, work together and collaborate with the system partners to enable the delivery of those government pillars and those agendas that colleagues have spoken to, that acute to community emphasis, that away from delivering the care to that prevention. And again, we've all mentioned, we absolutely together, I think, have got to capture, and we had a really good presentation at the conference a couple of weeks ago around the AI and digital space. And I think that we had some quite scary conversations actually at our last meeting around some of the things that we don't yet understand. And I think we've got to also use the networks within our institutions in those spaces, our computer sciences, our other people across other faculties in universities to inform our work as health faculties. But I think, the critical thing for COD England is we'll use our time together wisely. We'll make sure that we reaffirm our shared purpose aligned with the strategy for the council itself, and advocate those priorities that are coming from our regional groups. So I hope that's given a flavour. Thank you, James.
And look, on AI, I'm really conscious this time last year, we were so much further behind than where we will be next year when we're all catching up on this. So it'll be remarkable to see just the scope for what that means and the scale of change. Ewan, over to you. I know we've touched on this a little bit maybe about the elections, but is there anything linked to that or anything completely unrelated, I suppose?
Yeah, well, I think the elections is a massive opportunity for us. So there's a challenge in it because it's uncertain, and uncertainty can sometimes be a bit fearful. But I think there's a grand opportunity for not only Council Dean Wales, but also, you know, the various stakeholders that we work with to really influence policy and what goes into those manifestos. I think that's very important. So we've got to start that work early as well to make sure that we are being that influence. We already are. We're already starting in that space. But I think there's a great opportunity there to make sure that nursing, midwifery and allied health are very much in the forefront of their minds, because I think quite often they can get very much distracted with other things on the political campaign, but health is really important across the whole of the UK. And if you speak to the public as a whole, they always put the NHS as one of their main priorities. So people are very fearful about changes to the NHS. They're fearful of private providers perhaps overtaking elements of the NHS. So I think we have a part to play there. But I think there's lots of other things we can do. I mean, the university sector in Wales, like the rest of the UK, has had a real challenge with its finances. I think there is a job there for Welsh Government if it's really dedicated towards improving health outcomes in Wales. It might have to provide a better funding settlement towards universities to allow us to be able to support that. So I think there's lots of things there that we can do to influence that funding stream. We've seen a little bit with HAW. Have upped the funding, so that's great news. But it's also making sure that Welsh Government as well plays its part in relation to health. So I think there's opportunities there to try and have that extra income coming through to enable us to support our students going forward. But also, we talked about nurse academics. That research element that Jackie's just been talking about is really important. I think we can forget research sometimes when we're focusing on the education side of things. But without research, we don't progress as a profession. And that's across the board, whether it's midwifery, allied health or nursing. We need that research element to be really seen as important, not only by Welsh Government, but by universities as well. So my university is a post-92 university, and at the moment is very much focusing on the learning and teaching space, and research, I'm not saying it's taken a back seat, but to some extent it's not being talked about as much as it has been over the last few years. So we need to bring it back onto the agenda, because that really will show some great progress for us. And I think, you know, the other opportunities we've got going ahead, we are a small nation. That gives us an opportunity. So I think Jackie's real point there, that Westminster can sometimes be very complex. I think in England, it can be difficult sometimes getting access to the key people you need to have access to. In Wales, we have a better chance of getting those key people to the table. We've already had Jeremy Miles, the Health and Social Care Minister, come to Council of Deans. We can do more of that. So that greater working together is really important. And I think, just to echo what Jackie said, that working as a group, Council of Wales, Council of Deans for Wales and the Council of Deans nationally, working together is really important. And all the different nations that make up that Council of Deans is really important for us all, because we learn from each other. So, you know, having these events, having these conferences, you know, they're really important, because, you know, we do, well, from a Wales perspective, we really learn a lot from other nations in the UK as well, and other parts of the UK. So I think that's really essential.
Okay, thanks, Hugh. And finally, Susan.
Thanks, James. I'm conscious of time, so I'll keep it short. I agree with my colleagues. I think there's so much going on, but certainly for us up in Scotland, probably really key things around workforce planning. So we have really good data, because I guess our country is quite small. The data for nursing midwifery is decent, and we have population needs data that we can map on and lay on top of that. So we've got a real sense of what we will need. The issue, I guess, is that at the minute the demand is far out. Demand is far outstripping supply. Make sure I get it the right way around, and it's you know, diverging lines, which is really unhelpful. The data, though, for our allied health professions is really incomplete. So I think while we've got a good sense of what nursing midwifery needs, actually for allied health professions, it's a much different picture. So I think there's definitely something that we need to do in terms of making sure that that data is available. For me, I think we have a real need, and I've been probably lobbying ministers for the last couple of years around this, a real need to actually campaign to show people what healthcare professions actually do. So I still think in many ways that people will think nurses mop the fevered brow of a patient in a hospital ward. We probably still do that, to be fair, but there's a whole lot more that we do. So why don't we, you know, plug that whole celebration of our professions and really show people that you know, if youngsters coming through now are going to have 4 careers in their life, that's great, but let's have 4 careers within a health or, you know, environment, whether that's education, leadership, whatever it may be. But I think that's a desperate need for us, and certainly we will continue with that. I think that the ways that we go forward in terms of our education and the delivery of education, we need huge disruption of that, to be perfectly honest, to make us sustainable in the future. And this is not tinkering around the edges and sticking a plaster onto a gaping hole. This is now complete reform in my mind. Young kids coming through school don't see professions as in health as an opportunity. They see it as hard work, and probably the media is not really helping there, back to my campaign lobbying part. But the way that we actually bring people in, I think, needs a complete revamp across Scotland. I'm really glad that we're learning from others. So I was asked to chair a University Scotland Scottish Government conference on Friday last week around innovation pathways. We didn't just bring together nursing, midwifery and allied health professions colleagues, it was including medicine, dentistry as well, so all of the controlled subjects, but there's things that we can learn from our colleagues across other professions, and indeed they can learn from us. So to me, that's a really good thing that we should go forward with, and there's a real desire from both University Scotland and the Scottish Government to do that. And probably my final thing for me is the geopolitical landscape is really, really challenging, but we have to continue to probably lobby around the economic value of education is absolutely immense. And I think that is lost often in terms of what we are trying to do. It's not just about making sure we have a workforce for the future. It's actually, you know, adding to the value of that particular region, wherever it may be. It comes with huge benefit, but the more we can say about that, the better, because I think that actually helps our message around we're not just a workforce that, you know, will continue to be here with even less funding. You have to invest in us so that in turn you will actually invest in the countries. I'll stop there, James. Thanks very much.
Fantastic, and a perfect note to close on as well. So all I can do now is thank everyone for sticking with us. I know we've gone slightly over, but I think we've packed so much into this. I know that we'll be able to share this online as well with others who weren't able to make it or weren't able to make it fully to the end. But thanks everyone so much for joining us. Thank you so much to our speakers and for the work that you do with your work in the nations, but also for the council overall. So it's a really important partnership and we're very grateful for that. So we look forward to checking in again next year and seeing how we progress with all of this. But until then, thanks all and take care. Bye-bye.